My name is Mr. Arun Jain, and I am a consultant urologist. When I started my surgical training in early 90s, uh, I got to know that urology was one specialty which was using minimally access surgery for management of patients, which attracted me towards this specialty. And when I started doing urology, I realized that it is one specialty which gives you an opportunity to use a diversity of the surgeries, surgical techniques, which vary from open surgery, from endoscopic surgery, from laparoscopic surgery, from robotic surgery. So, from a surgical perspective, a contentment is gained by not just becoming proficient in one surgery, with, but to be able to offer patients a diverse type of surgeries as well. So, therefore, it has been really a satisfying career for me in urology. And also, in some time in early career, I also encountered a patient in my extended family who was not able to cope with a urethral catheter. And there was also a degree of stigma associated with a urethral catheter. So my aim was to how to get rid of catheters in patients. However, when I started doing urology, I realized that there will be situations where the patient only option might be to live with a catheter. And therefore, I'm also now concentrating in making patients how to live with a catheter better if that is the only option. I think whenever the patient satisfaction is the most rewarding thing. So if I'm able to cure the patient's symptoms, then it is obviously most fulfilling. But there are occasions when there is no cure for a patient's problem. And in those circumstances, I would like to try to educate patient to have the best, to how to best manage the problem and how to live with it. So there are other circumstances when the patient is actually seeking mainly reassurance only because they have been worried about their symptoms due to the lack of understanding and sometimes misinformation from media or from social internet, etc. So in those circumstances, I would like to educate the patient how to deal with these situations best. So the patient should expect an honest opinion when they are seeking consultation from me and when they are seeking surgical intervention or some invasive procedure, then they would expect the proficiency from me. So they would expect that they will be listened about their problems and they will be able to discuss the various treatment options and not just the surgical treatment options, also the medical treatment options wherever possible. I believe that a good surgeon is one who knows when to operate, but also knows when it is not best to operate. And the conservative treatment options may be more useful in those circumstances. So they would expect that I would guide them to be able to make an informed decision and elect whatever treatment option is best for them, and to educate them about their illness, to be able to live with it if it cannot be cured.